Hi, my name is Dr. Fredrick Echols. I'm the Acting Director of Health for the City of St. Louis. I'm here to talk to you about COVID-19. Unfortunately, there's a lot of misinformation circulating in our communities about COVID-19. We've been studying the disease for the past several months, and so today, my goal is to answer a series of questions that have been submitted to the Health Department from City of St. Louis residents. Kendall from the Jeff Vanderlou neighborhood asked, at the beginning of the pandemic, the recommendation was that people not wear masks. Now we're being told that masks or face coverings are critical to preventing the spread of the virus. What changed? So initially, the Centers for Disease Control and Prevention did issue a statement saying that they were not recommending the wearing of face coverings. However, they conducted several studies and investigations, and what they've learned was that wearing face coverings do prevent the spread of illnesses spread by respiratory transmission, including COVID-19. So learning that led to the change in their recommendation. And so whenever we have an unusual situation or a new disease, we have to learn about the disease, and what we learn guides our decision-making and guides our development of guidelines. Kim from the Wells Goodfellow neighborhood asks, how do face coverings prevent the spread of COVID-19? That's an excellent question. So face coverings do a couple of things. One, it protects individuals who are not infected from being exposed to infected respiratory droplets. And for those individuals who are infected, it prevents them from spreading it to others. So when we focus on how COVID-19 is transmitted, we know that it's spread by respiratory transmission, meaning that while I'm talking, I can be spreading infected respiratory droplets out into the environment. As they spread in the environment, they can land on commonly touched surfaces or other individuals. It can land on an individual's lips, mouth, and they can be inhaled. When the infected respiratory droplet enters into the body of someone, they can become infected. Over time, they may develop symptoms which will lead them to potentially spread the virus to others. So for individuals, when you're wearing a face covering, again, as I mentioned, it helps prevent you from if you're not infected, it helps prevent you from becoming infected by serving as a barrier between you and the surrounding environment. And for individuals who are infected, it serves as a barrier by catching those respiratory droplets while they're talking. And so overall, again, the studies that have been conducted by the Centers for Disease Control and other organizations have shown that wearing face coverings can effectively slow the spread of COVID-19 in our community. Louise from the Ville neighborhood asks, I've heard wearing a mask can be harmful. Is there any truth to that? There is some truth to that. Some individuals have underlying medical conditions that can be worsened by wearing a face covering. For those individuals with underlying medical conditions, we ask that they consult their medical provider for guidance, so they'll know how to properly wear a face covering, when to wear a face covering, and if they should wear a face covering. Helen from the Central West End asks, if everyone wore masks in public, what would that accomplish? Wearing a face covering prevents the spread of infected respiratory droplets. So that reduces the number of individuals that are exposed to COVID-19. By reducing the number of people that are exposed to COVID-19, we reduce the transmission or reduce the spread of COVID-19 in our community. Valerie from the O'Fallon neighborhood asks, when should masks be worn? Valerie, that's a great question. Face coverings should be worn, or face masks should be worn whenever you're out in a place that provides public accommodation. For example, if you're going to the grocery store, if you're going to pick up takeout, or if you're going to a place where you may find it difficult to physically distance yourself from others. And this is important again, because wearing the face covering prevents the spread of COVID-19 for those who are infected and those who are not infected. Sylvia in the Tower Grove South neighborhood asked, what is the difference between cloth masks, surgical masks, and respirators? The difference is that surgical masks and respirators are medical grade equipment. We reserve this equipment for our medical professionals who are providing essential health services for for patients because they have a higher risk of being exposed to individuals that are infected with COVID-19 and other respiratory illnesses. Cloth masks can also, although they're not medical grade equipment, can be effectively prevent the spread of COVID-19. Again, because our medical professionals have a higher risk of being exposed to individuals who are infected with COVID-19, we reserve medical grade equipment for them to ensure they're able to properly protect themselves while they're providing essential care. Christine from the Kingsway West neighborhood asks, how long can you wear a cloth mask before it needs to be cleaned? How do you clean it? A cloth mask can be worn 1 to 2 days. However, if the mask is visibly soiled, we recommend that you clean it before wearing it again. You can clean it just like you clean a shirt. You can throw it in the washer with detergent, and then you can dry it by either drying it in the dryer or allowing it to air dry. I'd like to thank everyone who sent questions and all of you for tuning in. Next week's topic will be returning to school during COVID-19. I really want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Again, that's HEALTH@stlouis-mo.gov. Questions will be answered in the order they come in. If I run out of time on air, your question will be answered by return email. Be well, St. Louis.